I am going to be going over some things as far as behavior for our treatment notes, our notes for our continuing care patients, and the importance of those. I'm going to share my screen so we can kind of all see what that looks like. Let me share here. So I have my patient open and pulled up. I'm going to come to the restorative chart so I can start a new progress note for this patient. I'm going to pretend that this patient is a nitrous appointment. So of course I'm going to add new note. I'm going to select nitrous and do my normal doctor, add myself just for fun, any local anesthetic, and go over the different scorings that we have for behavior. So of course, we'll start with Frankel for happy and excited. I think that's pretty self-explanatory. When it comes to a treatment or a sedation, that's just a great patient who was excited to be there from the very beginning to the very end. Cooperative and content for Frankel 3 is going to be just a normal patient. That differs from our continuing care cleanings, from our treatments based off of just continuing care. When we have a cooperative and content patient, that's just somebody who's just there, going with everything, going with the flow, not overly excited, not giving you a hard time. And the same for nitrous or sedation. For Frankel 2, anxious and minimally cooperative. This is important, especially if we're diagnosing a sedation during a continuing care visit. Just because we had to do a little bit more coaxing, maybe we had some tears and we finished off and got everything done that we normally needed to get done. But again, we just had to put a little bit of extra work in there. Uncooperative and combative, that is usually, when it comes to our continuing care appointments, that is usually a patient who starts out in the hygiene bay and ends up being seen in a treatment room or a baby room because things went from okay to worse pretty fast, okay? So these are all going to be important when it comes to a continuing care visit because it helps us figure out what kind of treatment this patient's going to need under general anesthesia, under sedation, under nitrous. So we really want to make sure that we understand what these things mean and we're selecting what best fits our patient. While we are also doing that, for a nitrous appointment or a sedation appointment, it's really important underneath the primary RDA. There is the appointment summary. This is going to be the part where you put in something that stands out about the patient, whether it's patient was not happy during the visit or patient had a hard time taking meds. Patient started off really good but cried with the nitrous nose. These are all things that are going to be important that will also help change the scoring that you give your patient. These are important when it comes to second appointment visits, as far as if we're going to continue to try to push through and do a second nitrous visit, or if we're going to push through and just go that extra mile for a sedation. If the sedation just failed, it went really bad. Patients spit out half their meds, they fought the entire treatment, doctor only got through a portion of the treatment, those kinds of things. They're all important when we're continuing to diagnose further treatment, our next steps, and just for future visits. For future visits, whether it's a continuing care visit and we are trying to prepare the next assistant for what's going to happen. So as long as you guys all feel comfortable with these, and if you have any questions, please don't hesitate to ask your local trainers or your doctors and get their takes on things.